So before I come in, I'm going to check my medical order, see what I need to be doing. I'm gonna go gather all my supplies, which I have here, and then come in, knock. Hi, my name's Hannah. I'm gonna be your nurse today. We're gonna be doing a wound change. Got all my supplies ready here. Can you confirm your name and date of birth for me? Perfect. And then I'm just gonna raise your bed a little bit and make it a little more comfortable for both of us. Okay, you have a chuck underneath you, that's great. And how do you do with your wound changes? I know you've had a few done. You do pretty good. Okay, I know we gave you medication about 30 minutes ago. Is that been kicking in? Hey, sounds like we can get started. I'm gonna close the curtain. And hand hygiene. Bring the trash can over. Rip on hand hygiene because that's trash. Okay, so I'm just gonna take this off, make sure I'm careful and go with the hair. Okay, I'm gonna check it, see if there's any, note the color, the odor, everything that's on this old one. I'm gonna throw this away. I'm gonna unpack it. Okay. Is it, everything's good? Looks pretty good. We're gonna check the size of it real quick. And there wasn't any drains in it, so we don't have to do anything with that. I hate opening these. Takes forever. Sterile thing. I'm just gonna grab the top. It's sterile. I'm going to not touch the skin, but make sure I measure it. 7, 3, and then check it. 1. Then this isn't sterile anymore, so we can throw it away. And now I'm going to remove these gloves and do hand hygiene. And now we get to open our sterile field. Get this open. I'm just going to move this way, make things easier for myself. And then I have this other table with my sterile gloves over here just to make sure don't ruin the sterile field. Okay. Jump. These ones are old, so they don't like to open easy for me. Now we can fix our gloves because we are sterile. Keeping our hands. Okay, going to get my sterile field ready. So get this open. I'm going to take it out. They're different size gloves, so I need those. And then if this ever touched that, it wouldn't be sterile anymore, so we'd have to switch that. Okay, and then we are going to pour our water into here. It touched the side, so it won't be sterile. Just note that. Okay, and then you're going to wet our gauze. So every wipe you do is with a new gauze pad, so we're gonna go top to bottom. So I throw this away after I get a new one that's wet and sterile. Other side, throw this away. New one, clean the inside, and then I throw this away. Make sure everything is clean. I get another gauze pad. And then again with this, every wipe is with a new sterile one, so I get a new one every time. Making sure that is all clean. And then we're going to pack this wound because it was packed before. I'm just gonna take some sterile gauze and we would pack it in there. And then at this point, or any other point, if I had soiled my sterile gloves, if there's anything on them, I would change to new sterile gloves. So now get our new cover, put that on, and then we're going to tape it down. This is fun. Just like how it was taped before, making sure we're not like pulling on their skin or anything. It was taped up here at the top, going around their leg. So we'll do that again on the top. Make sure it's nice and covered. Do that again on the bottom. Maybe tape the bottom. Making sure then I cover my patient back up. I'm gonna remove my gloves, put on hand hygiene, make sure my patient is okay. I'm gonna lower your bed. Oh, that's fine. Ask if they're in any pain, if there's anything else they need me to do, and then everything that I've been using is going to go into this red bag on my trash, just because it's bloody or anything like that. So I go document everything, come back and check them every now and then whenever I need to, and make sure that they have their call lights so they can call me if they need anything.